Hey guys, Tony Maritato here, licensed physical therapist. Let's talk about how long a physical therapy session will take after your rotator cuff repair surgery. Now, this applies to rotator cuff, to labor repair, total shoulder replacement, pretty much any surgical intervention done to the shoulder. Usually the first day of therapy is the initial evaluation. Now, there are some therapy providers that only do the evaluation and do not do treatment on the first day. I can tell you that at my clinic, it really depends on when I'm seeing the patient, how far from surgery it is. We have some surgeons that want me to see and evaluate their patient within 24 to 48 hours. Those patients are still groggy, they're still under the effects of the anesthesia. There's not a whole lot for me to do. So those evaluations are typically 20 or 30 minutes in duration. It's a very simple, comfortable, easy physical therapy session. But if I'm seeing a patient for the first time 4 weeks after surgery, they're probably going to be with me 40 to 60 minutes because I'm going to complete the initial evaluation and we're going to initiate treatment right then and there. They're feeling better, they're more alert, they're more awake, they're not nauseous or tired. So it really depends on where you are in the recovery process. Now, after the first visit, after the initial evaluation, a typical follow-up visit will be anywhere from 30 to 60 minutes. During the first 2 to 4 weeks of physical therapy after a rotator cuff surgery, most of what we're going to be doing is passive range of motion because you're typically not allowed to move the upper extremity on your own as a patient. We're going to be reviewing the home exercises that you're doing. We're going to talk about positioning. Make sure you're sleeping as well as you can. Make sure you have the sling in the right position. We might do some soft tissue massage to the muscles around the shoulder, at the base of the neck, the middle of the back, down in the arm and the forearm. A lot of patients will develop some elbow pain and bicep pain. So we're going to try to relieve some of the secondary problems that happen after your surgery. And we're simply going to make sure that you're progressing as expected based on your surgeon's protocol. Every surgeon has a little bit of a different protocol, and so we're going to follow your specific surgeon's protocol. By the time you're about 6 to 9 weeks post-op, you should be feeling a lot better. You should have a lot more stamina, a lot more endurance. We're going to be doing more high-level functional activity. The time you spend in the clinic for a follow-up physical therapy visit, again, probably 30 to 60 minutes. Some of that time is going to be spent on your own doing your own exercise, while more of the skill-based exercise that you can't do by yourself will be done with your physical therapist. The only other kinds of physical therapy treatments that might take a little longer than usual are the days that we have to do a progress report or a discharge summary. A lot of patients here locally will go for a 4-week follow-up with the surgeon, or they might go for a 2-week follow-up where they remove some of the surgical sutures. So depending on when you're going back to the doctor, your physical therapist will perform a progress report in which they'll measure your range of motion. They'll compare it to the initial measurements. They'll look at your progress with functional goals. They'll look at things like how well you're dressing, how well you're bathing, how well you're sleeping. And then they'll create a report for your surgeon to let them know this is where you were at the initial evaluation, this is where you are currently, and this is where we plan to get you before discharge. So those sessions might take a little bit longer, closer to 60 minutes. But really it just depends on how well you're progressing, what your preference is as a patient, because you do have influence on if you do a 30, 60, 90-minute physical therapy evaluation and treatment, or what your therapist chooses to do. So guys, I hope that brings some light to, answer the question, how long is a physical therapy visit after a rotator cuff repair? I'll catch you on the next video.